Hello everyone, welcome to MKA E-Class. I'm Professor Yoon-Seok Lee, the Director of Colorectal Section. I'm very happy to introduce MKA E-Class Advanced Colorectal course. This Advanced Colorectal course consists of 5-day courses, and outstanding 23 colorectal surgeons in Korea participated in this session. And every session included advanced surgical technique and clinical evidence of each surgical techniques. In first day, colon cancer surgery with complete medullary excision with central vascular ligation, intracorporeal and extracorporeal anastomosis, complexity of transverse colon cancer, and splenic flexure takedown are included. In second day, rectal cancer surgery, including TME and lateral pelvic lymph node dissection using laparoscopic and robotics, will be discussed. In third day, extensive rectal cancer surgery, such as pelvic excentration and extralevator abdominal peritoneal resection, will be discussed. In fourth day, miscellaneous surgical techniques, including ICG to check the perfusion status, and technique of safe stapling and surgical bond, will be discussed, and also specific treatment strategies using Stent for obstructive colorectal cancer and neoadjuvant CCLT or total neoadjuvant treatment for locally advanced rectal cancer will be discussed. In last day, surgical complications such as surgical site infection, anastomosis leakage, ileus, and incisional hernia will be presented. I believe our MKA E-Class Advanced Colorectal course will be very informative and helpful to all the audience. On behalf of colorectal surgeon in MKA E-Class, I'd like to give my special thanks to all participants for joining our program. Please enjoy MKA E-Class Advanced Colorectal course. Thank you. Thank you very much.